The SECOMBIT study is a randomized phase 2 study which try to answer to the question which is the best sequence if start with target therapy is first or immunotherapy is first. It's a randomized phase 2 study with 3 arms. One arm with the sequence target therapy Encorafenib, Binimetinib, and then in case of progression Ipilimumab and Nivolumab. Arm B, Ipilimumab and Nivolumab, and then in case of progression switch to Encorafenib, Binimetinib. We have also an arm C, the so-called sandwich. Why sandwich? Because immunotherapy is put in the middle of 2 courses of target therapy. There is a 2 months induction with Encorafenib, Binimetinib, the switch response to Ipi-Nivo, and then in case of progression, again, Encorafenib and Binimetinib. This ASCO, we present data about the subgroup of patients, the patients with less than 3 and more than or equal 3 metastatic site involved, and the patients with the normal LDH and elevated LDH. As first, at 3 years, the total progression-free survival it's in favor of the arms who started immunotherapy as first, arm B and C. The arm A, the total progression-free survival was 34%. In arm B and C was respectively 56 and 54%. Overall survival, arm A was 54%, while in arm B, 63 and 60 in arm C. So there is, even for overall survival, an important trend. Looking to the subgroup of patients, again, there is a trend for arm B and C. So the arms who started immunotherapy first, and probably the most interesting data is about the elevated LDH, because in the elevated LDH group, the sandwich arm was really better, with an overall survival of 65% compared to the 42% in arm A, targets first, and 50% in arm B. So the data looks still interesting, and in one of the next meetings we will report with a longer follow-up also the 4 years overall survival.